Good morning, all, and welcome to this panel discussion on the ethics of economic ordeals. My name is Anders Herlitz. I will moderate this session. As many in this room are aware, theories of distributive justice tend to focus on either currency of the good or on patterns of distribution. We're familiar with quarrels about whether it is distribution of resources, opportunities, well-being, or perhaps capabilities that matter. And we're familiar with debates regarding whether equality, priority to the worse off, maxim-min, or some other benchmark should be used to evaluate different distributions. We quite rarely speak about the method of delivery, how goods are distributed. In this panel, we shift our focus toward this issue. What methods of delivery are permissible when one pursues more just outcomes? In particular, we will discuss the ethical aspects of using economic ordeals as a method of delivery. You will hear much more about this very soon, but very briefly, economic ordeals are interventions that deliberately make access to products or services slightly harder so as to improve outcomes. For example, by weeding out recipients who need them less or who are otherwise less likely to use them. Perhaps surprisingly to people outside of behavioral sciences, there are reasons to believe that using economic ordeals as a method of delivery can result in what appear to be desirable outcomes. For example, in case one makes benevolent interventions with the purpose of improving health or economic development. This raises a series of ethical issues. For example, in some of the contexts in which economic ordeals are promoted as a method of delivery, individuals are really badly off. Is it really permissible to make a desperately needed good less accessible in such circumstances? Further, might not some ordeals, for example, so-called make work, be humiliating? Is it permissible to humiliate people if it promotes better outcomes? Isn't there a risk that ordeals will lead to less desirable patterns of distribution? Not all potential beneficiaries will have the same opportunities to pay the price that the ordeal constitutes. Furthermore, what might an ethics of actually testing ordeals be? To discuss these issues, we have three brilliant panelists with us, Nir Eyal, Julie Rose, and Richard Zeckhauser. Each of them will speak for about 15 minutes, whereafter we open the floor for questions. First, Richard Zeckhauser is the Frank P. Ramsey Professor of Political Economy at the Kennedy School here at Harvard. He is elected Fellow of the Econometric Society, the Institute of Medicine, and the American Academy of Arts and Sciences. He has published over 300 academic papers, 13 books, and countless op-eds. Besides his academic achievements, he has also won multiple national championships in contract bridge. Much of Richard's work focuses on decision theory and behavioral economics, where he has developed concepts such as status quo bias and betrayal aversion. Much of his work on policy explores different ways to improve markets' effectiveness and to promote health. He is one of the architects of economic ordeals. Richard will provide us with an introduction to economic ordeals and provide some examples of how they might be useful.
Thank you. So I was also asked to explain what ordeals were. I thought Anders did a great job, so you're going to have to listen to it twice. My basic point is we have to allocate resources. We have lots of different ways of allocating resources, and you have to choose one. Now, the typical way that we allocate resources in this society is through the market. But I assume that you paid nothing to get into this particular conference, and it's incredibly valuable. And so sometimes we sort of say it's entitlement or something is free. But there are many resources that we can't make available for free, and you have to decide what allocation mechanism that you want. My guess is that many people in this room have written arguments against using the market to allocate resources in particular areas. And then you have to figure out what to do. Economists call this a second best situation. And any instrument that you're going to propose is going to have advantages and drawbacks. So ordeals, as the SAFRA program said and as Anders said, is to make access to products or services slightly harder. Now, that's from what they originally wrote. This morning it was harder. To weed out recipients who need them less or are otherwise less likely to use them. In economics, we refer to this as a screening mechanism. So what we're trying to do is we're trying to decide who are the higher value users. And the term that we use is target efficiency. So if the people on this side of the room are going to get great value out of something, and the people on that side of the room are going to get low value out of something, and we just run a lottery so that 8 people get it, and it's 4 from this side and 4 from that side, that's very poor target efficiency. And that's the whole notion of ordeals, to get people who get greater value to do that. The trouble is that though you know how much value you're going to get out of something, the person who's allocating the resources often does not know how much value you're going to get out of something. So what we do is we say we don't want to charge you money, but we will make you do something that's hard in order to receive it. What's the downfall of ordeals? Is there's a deadweight loss. If, as Anders said, you're humiliated by having to stand in line to receive something, you lose, but I don't gain. And so a typical situation is waiting time to receive a transfer program. You can think of, we're handing out welfare benefits. We have 2 categories of recipients. One is people whose parents will support them if they don't get money from the government, and other people who are legitimately poor. And then we sort of say you have to stand in line. The first group of people, those who have parents who can support them, won't be willing to stand in line. So here's some health examples. By the way, this is the paper that I wrote with Nick Nichols, who's in the second row. Raise your hand, Nick. Okay. President Reagan, who had a keen eye for understanding things, actually reversed an ordeal. We frequently have this provision. There was a little girl who had viral encephalitis who wanted to be treated at home. In those days, and indeed in these days, the only way you could get coverage for care was by being in a hospital. President Reagan, recognizing this, as you probably don't know, but presidents can commute criminal sentences, and presidents can commute ordeal requirements. And he commuted the ordeal requirement and said, we're going to treat this wonderful little girl at home, and I will be a hero. And that's the whole notion of what ordeals are about. I'm sure that people in this room have had experience with that particular ordeal. When you're elderly and you need some level of care, you have 2 choices. You can go to a nursing home where you are covered by Medicaid if your resources are appropriate, or you can be treated at home. It's cheaper in general to treat you at home, to have your family members treat you. It's also more humane to be treated at home. But we have decided, society has decided, that if we let people get treated at home, vastly more people will get access to these dollars. We're not going to allocate that many dollars. So we have this provision, which is in effect an ordeal. You have to go to the nursing home if you want to get any coverage. Why do we have this provision? Well, medical conditions are not fully monitorable. My mother doesn't have such severe problems, but I still would like to get coverage, and I would say that she needs this coverage at home. So that's basically what we do. So if those who have greater need actually, and this is the little girl, actually are better off in the hospital, then there's no deadweight loss. Only the people who really need it will go to the hospital. Indeed, most of the people wouldn't have wanted to have been treated at home. Okay, so in England, probably many people in this room are admirers of the English healthcare system. If you need an operation, the ordeal that we have, it's not one where you're humiliated. You're just walking around with your knee, which needs replacement, for 11 months in pain until we replace your knee. So I'm supposed to give health and development examples. I'm going to use the example subsequently of chlorine tablets in Kenya. There are multiple uses for chlorine tablets. The one that the aid organization wanted to promote was the use of chlorine to purify water so that people didn't get sick. But people also like chlorine, as probably many of you do who use Clorox, to get their clothes cleaner. The trouble is if you hand out chlorine tablets, people will use them to get their clothes cleaner. So what they did is they said, we're going to give you a pretty minor ordeal. We're going to give you a coupon book. and you get one coupon for each month to go and get your tablets, and you've got to go to the distribution center to pick up your chlorine tablets. Actually wasteful. It would have been just as easy to give you all your chlorine tablets and just distribute them, but it actually did a remarkable job of sorting people between those who needed it for pure water and those who needed it to wash their clothes. In Indonesia, and this has also been done in Mexico, the way we allocate resources for people who are poor, they don't have very good monitoring systems on how much you earn, is they go and they look at the appliances in your home, and they assume that people who have washing machines are richer than people who don't have washing machines. So the only way you can qualify for a larger cash transfer is to forego your washing machine. Well, this is an ordeal as well. Your family sort of says, we'd really like to buy a washing machine. They said, no, wait, that's going to get us 30 less units of resources every month. Okay, why don't we forego the washing machine? So that's another type of ordeals. And ordeals come in all types of things. So society must allocate resources. Let me give you examples in health. We have antihypertensives, we have expensive drugs, and we have kidneys. We can't make kidneys available for everybody. We don't have enough of them. Expensive drugs, we have to figure out a way of rationing them because they're basically, like right now, 56% of expenditures under Medicare Part D are for highly expensive drugs. And then antihyperintensives, which we charge the same copay for, at least at Harvard, as we do for almost any other drug, should be given away for free because many people don't take their antihypertensives. They're very cheap, and we don't want to discourage anybody from using them. In academics, secondary education, in the United States, we decided that everybody should get it for free. Charter school places, vast oversubscription in places like New York City. We give away by lotteries. Inclusion on a SAFRA program. Well, Anders and Nir, they decide who do they want to have on the SAFRA program. I would like to think it was cost effectiveness, but I think actually they were looking for people under Z, and I came up. Okay, consumer goods, clearly color televisions, we allocate through the market. Development in health, I've mentioned those examples. And, you know, we're going to have a wonderful lunch later. You can have lunch with Anders and Nir. How should we give that out? My recommendation would be a lottery. Danielle, okay, we'll run a lottery to have lunch with them? Okay. So I've got approval from higher authorities that will all work out. So, these are alternative things we can do. An entitlement, everyone gets for free. The advantage of that is it has none of the disadvantages of other mechanisms. Okay. The disadvantage is that there's a lot of dead weight loss. A lot of people will take it who don't really value it. Okay. If we had an expensive lunchbox that cost us $20 a piece, some people would sort of say, oh, I'll pick it up. I would have paid $5 for it, but it's not worth it. Okay. So, and sometimes supply restrictions operate like as, for example, with kidneys. Lotteries, only 1 out of N people gets it. What's the advantage? It uses up the available supply and it's perceived as fair. What's the disadvantage? It's inefficient. We run the lottery. Joe and Susie here, they're hypotheticals, get to have lunch with Anders and Nir, but they don't really care that much about it. These people, Ralph and Joanne, would really like to have had lunch with them, so we've given the resource to the wrong person. Market, everybody who pays for it will get it. The advantage is efficient. Economists love efficiency. The disadvantage is that individuals who may value the good more highly and get the greatest value from it don't necessarily get it. It also ignores externalities from goods, such as for something like vaccines. Cost effectiveness. The advantage is that the resources go to the highest value users. So that's great, but it has a disadvantage that we also do not have the information to provide cost-effective allocations. And that's where ordeals come into it. This is a guy has to carry a rock in order to get some wonderful thing. When individuals evaluate, the advantage is when individuals' valuations are private, we can allocate resources to the highest value users. The disadvantage is there's a dead weight loss, for example, of waiting time. And individuals may have different costs for ordeals, which is something that's often not recognized. So let's assume that what we do is we have a waiting line for something. And A doesn't mind sitting in the line. Indeed, he gets inspired. He writes poetry while he's waiting in line. Waiting in line bothers him not at all. B, on the other hand, has other priority uses for her time. So the resource goes to A just because he's a poet, as opposed to B. Now, there are some situations where people will sort of say, but I can identify a class of people whose waiting time is more valuable. For example, mothers with children. They can't just stand in line because their kids will be on. So what you could do is you could have a special line for mothers with children. You've all experienced this. You go to the emergency room, and as you walk into the emergency room, they say, "What's wrong with you?" You say, "I cut my finger on the vegetables," and they sort of say, "Okay, go sit over there," and you go sit over there for 3 hours. On the other hand, if you sort of say, "I'm having intense pains in my chest and pains are shooting up and down my arms," they sort of say, "We're taking you into the operating room immediately." So we can do this. So understand, ordeals are a second best mechanism. But when you choose them, you have to be comparing them to other ways of allocating the resources. Economists like to say that there's no free lunch. I like to say that when information is not there, there's no perfect allocation mechanism. They should only be used when their net advantages, so I talked about the advantage and disadvantage of each type of allocation mechanism, are greater than the net advantages minus disadvantages of other possible mechanisms. Would you rather have the ordeal, or the market, or the lottery, or an entitlement? So a lot of I guess this is my most important lesson. A lot of care, when you're choosing an ordeal, a lot of care should go into the design of ordeals. Promote their sorting value through the least cost and the deadweight loss. Humiliation tends to be, I think, is a pretty poor type of ordeal. Rather than have recipients just wait in line, have them do useful work. In order to teach, this will resonate with some people here. I presume a reasonable number of us have a PhD. In order to teach introductory statistics in college, you have to have a PhD in statistics. This is a wonderful situation. Those PhDs, for 90% of them, never get cited. The person has to work really hard for 5 or 7 years to get the PhD, and it makes them somewhat worse teachers of introductory statistics. Why do we have that ordeal? I'm a statistician. I don't want too many statisticians around. So it's very poorly designed if you're trying to get effective teachers. It's very effectively designed if I don't want to have more competition. And then we have some unnecessary ordeals. My favorite unnecessary ordeal, because it's one that I encounter, is waiting at the doctor's office. If you have an appointment at the doctor at 2 o'clock in the afternoon, you should expect to get in to see the doctor at 3:45. One of the things that I observe is that, in contrast to the doctor's office, dentist's office tend to be much more efficient. Large numbers of people are paying for their own dental care. As a consequence, dentists decide that it's not worthwhile to keep you waiting, or people wouldn't go to them. So I'm running out of time, and I'm not even going to go over this slide. I'm just going to sort of say that ordeals are neither the devil's tools nor are they panaceas. Thank you.
Thank you, Richard. That was great. So our second speaker is Nir Eyal. He's an associate professor at the Department of Global Health and Population at Harvard's Public Health School. Nir received his DPhil from Oxford and held postdoctoral positions at the National Institute of Health and at the Center for Human Values at Princeton before coming to Harvard. In 2009-2010, he was a fellow here at the Safra Center and currently serves on its faculty committee. He has published over 60 articles and is co-editor of Oxford University Press's population-level bioethics series, for which he has also edited 2 volumes. Nir's work spans many topics in bioethics and philosophy, from ethics in HIV cure trials to egalitarian theory. Nir will review the many ethical issues that arise in relation to economic ordeals.
Thank you very much, Anders. This paper will reflect work in progress that is currently underway with Chris Robertson, who is speaking at the other panel right now, and with Paul Romain. Can you raise your hand, Paul, who is the doctor in the group? we just want to, it's not so much you'll see that it's not going to be a very kind of thesis kind of lecture. The point of this panel, I think for all of us, is mainly to raise points for a group discussion together. So there will be many teasers here for you to follow up on. Physician assistants are, for many patients, indications either as good or only slightly less good for those indications, for addressing those indications, than very expensive PCPs and very, very expensive specialists. Yet patients often want to see the specialist in a way they have nothing to lose if they see the specialist, and why not from a selfish point of view? The advocates of these patients, their clinicians, will often refer them there. We have a social need, it's more efficient, it's fairer, to direct more patients to physician assistants than is currently the case in America. There are 3 ways of doing that. One, which we shall call direct rationing, simply blocks the option of seeing the specialist. You either don't train or don't hire specialists, don't create any eligibility for anybody to see the specialist in that particular area, or somewhat less crudely, you have criteria which are top-down and decide who can go there. There might be a committee that is listening to the individual, but the individual has an interest in faking things with that committee. It doesn't know very well the private information that that individual has, that their trusted advocate has about their condition. So there are some inefficiencies there. You can impose a financial cost on the individual or on their advocate. One of a variety of sorts of financial costs can be the disincentive to go for the expensive option, so that they need to think twice. So another way of incentivizing, say, the correct use of chlorine, etc., could be a financial cost involved in that. And there's a third way, which is ordeals. It's also indirect rationing. It also involves, it's indirect in that it involves the agency of the patient or the advocate of the patient. They use their private information or private opinions to help us sort the good. So you make it onerous to go to the specialist. Alan Garber, who spoke here yesterday, has an article where he argues that the excessive use of specialists in the US compared to the UK has to do with the much shorter wait times for specialists in the US compared to the UK. And there are other ways to make people experience a burden, not a financial burden, a non-financial burden, if they want to use the expensive option or the option that, from the system's point of view, it would be otherwise less efficient or less fair for them to use. There are many ways to achieve that, which are not directly financial, ranging from making the patient walk all the way to the other side of the hospital, or making the clinic of the specialist the less sunny and nice clinic in the hospital, or all the way to embarrassing you, putting the brand name, say, that we don't want you to take as opposed to the generic, behind the counter. It's not over the counter in a way that involves basically either no rationing or only the financial participation. You simply pick it and go out. It's not available or not available without a prescription that is given only to some. It's available in principle, but it's kind of embarrassing. You need to ask them, is it okay for me to, and then they give you a dirty look. They say it's not really what you need, and you say, but I still want it. Things of that sort. And maybe that kind of threshold is sufficient for dissuading some people. Still crude, like many ordeals. You can start seeing some of the complications, but there is also clearly something to be said for using that. Doctors hate ordeals, which they call rationing through inconvenience. There is a very vividly worded article on that coined the term rationing through inconvenience in the New England Journal a few years ago by a doctor named Gerald Groumet. He focuses on, to be fair, not exactly on the ordeals that we are talking about here, but rather on the trickery employed by private insurers that are trying to make the most money by creating all these administrative hooplas that you need to go through in order to get things that you basically paid for and you're eligible for, making it harder for the patient and for her physician to capitalize on her eligibilities. Donald Light, who was a fellow at SAFRA a couple years ago, wrote an article in a similar spirit about rationing through inconvenience, which is basically our word for ordeals. And there are others who say that a lot of the problems in the American healthcare system, the burnout, the attrition that clinicians feel and react with, has to do with these admin tasks that ordeals that focus on the providers make them go through. Interestingly, however, there are many things that we can say for use of ordeals as a sorting mechanism, as a rationing mechanism from the system's point of view. Let's compare them to direct rationing and to indirect but financial rationing methods. So starting with direct rationing, ordeals allow us to glean that private information that the patient and her provider have privileged access to and customize a service that is potentially more attuned to the patient's real needs if indeed everything works all right. And that's an efficiency that doesn't exist in direct rationing in as much as the committee doesn't have access to that information. The committee that decides on the criteria and eligibility for something. Steve Burton and Zeke Emanuel, who spoke here yesterday, wrote in the context of allocation of expensive drugs that indirect forms of rationing have an advantage of direct ones in that they serve the very important value of autonomy in bioethics. We give you a choice. You choose whether you want to put in the effort. And so if you are willing to, there's something valuable about that. You have more freedom. There's something to this, but it should be taken with a grain of salt. This is not an area where we're talking about a patient who is entitled to a certain good, and we give them the freedom that they only deserve when it comes to controlling their own body or something that is clearly within their zone of ownership. It is an area where that's not so clear. So it's nice to give people more choices, but it's not ethically crucial. It's maybe not a right of the people to autonomy in this area, I would say. There is also a complication in the case of, Richard mentioned, very burdensome ordeals versus just burdensome ordeals. I don't remember the wording. Legal theorists will often call this an undue burden. Sometimes an ordeal is so onerous that it leaves you no real choice in a certain sense, except to, say in our case, go to the PA, not the specialist. The burden is very, very high indeed. Waiting in pain for many months, waiting in pain, waiting with a tumor for many months and worrying that maybe it's growing. And that, people say nowadays, in Texas, for a 16-year-old without a driving license, drive out of state to get her abortion. That's an example which is problematic on many, many, many realms. It's not a simple case of rational rationing. But you can see also there is a case to be made for also a complaint about undue burden there. It leaves you no choice. It cancels the autonomy factor. You might argue that because of that choice, there is a certain measure of lack egalitarian justice in this. I think that's complicated, and I'll maybe skip this discussion. What about advantages compared to financial participation in direct rationing? It's clearly less regressive, and this is really important. Financial participation, when it's done the ordinary way, of everybody pays the same, say, copay, the same deductible, is very directly regressive. Very directly unfair if you believe that being regressive is unfair. Ordeals are more complicated. Everybody has only 24 hours a day. In fact, people who are unemployed may have more spare time than the busy CEO. So it's complicated. Sometimes it works against people who are poor, against minorities, against, say, we'll talk about that. It creates some disparities. We'll talk about that in a few minutes. But not always. So it's more complicated. Financial participation is more directly bad for people with low socioeconomic status when it's done the ordinary way. You might argue that when you're focusing on things when you're deliberately inconveniencing people, when you're deliberately burdening them, then by definition of inconvenience, there's something experienced and unignorable about that disincentive. In a way that some of us can kind of, being flaky, forget about the money involved in certain transactions. It creates, in that respect, potentially a more powerful, a more experienced disincentive, and is more efficient in that way in motivating the behavior that we want. There is something less directly commodifying about compelling you not to think about, oh, is my knee pain, resolving it with the expert, is that worth my losing a certain amount of dollars, or the doctor's thinking that? Is my patient's quick resolution of their, or efficient resolution of their knee pain worth my losing a certain amount of dollars at the end of the month? It's another trade-off. It's about my knee pain versus a burden. But you could argue that that exchange, both of these being, it's not two realms that are completely divorced from one another, like money and the body. It's the body sometimes versus the body. My standing in line, that's unpleasant, versus my knee pain long-term, is more acceptable. The ethics of whether there's anything wrong about commodifying and whether this is the better is complex, and we could discuss it. When it comes to financial participation, there is very clear conflicts of interest for, say, the practitioner, who is being very deliberately being made to think many times a day, do I want to spend this amount of money by referring this patient, even when somebody has good reasons to go, say, to the specialist? Do I really want to spend this amount of money for my patient's better health? With ordeals, it's not a financial conflict of interest. It's a complex question whether non-financial conflicts of interest are less severe than financial ones. There has been in some areas actually some evidence that they have less corrupting effects, but we didn't look in detail at every type of burden and utility, etc. So the question is fairly open, I would say. There are also disadvantages to ordeals. Let's compare them first to financial participation. We mentioned the disparities. There are some systemic ways in which ordeals tend to be worse for certain groups, or certain types of ordeals tend to be worse for certain types of groups. If I'm not a native speaker, if I'm a newcomer to the country, it's harder for me to fill a long, deliberately long form. If I don't have time because I'm a single parent with a demanding kid, then I don't have that time. If I'm an American worker without paid medical leave to stand there in the line for the service, I can't afford that. If I have a different kind of contract, I can't afford that. This one is complex for me. It's not as straightforwardly bad as regressiveness, because sometimes the groups being influenced badly are the advantaged groups. We mentioned earlier the example that people who have a job are sometimes more adversely affected by having to stand in line than people who don't have a job. You may argue it's still not okay that you're targeting any particular group. We might disagree there. And some of these disadvantages to particular groups can to some degree be mitigated. You can target a social worker to people who don't have English as their first language to help only them. You can create forms in many languages. So these solutions are not going to be perfect, but there is something to be done about the challenge of disparities. Richard mentioned the dead weight waste. He also gave examples where there isn't, strictly speaking, dead weight. For example, makework that can create bridges and dams. But oftentimes there will be this difference from financial participation, where the money typically it's not just burnt, but goes to some pocket that may circulate in a useful way. Or these are less easily quantifiable than money, typically. So with money we have units. The copay for this is $10. The copay for this, for whatever reason, we chose to make it $40. With ordeals, not always. We have the minutes that it takes the assessor to fill the form as a measure of how onerous the form filling is. The minutes that it takes a GPS reported drive to the clinic. But what are the units for the disutility involved in listening to music when you're waiting for them to answer the phone and help you figure out some admin detail? We don't have measures for all of these. Sometimes I want to say this, I don't want to blow out of proportion the importance of this disadvantage. Sometimes these units are not as helpful even in the realm of money as we take them to be. So it's not always the case that the marginal disutility of paying twice the money is not decreasing. Sometimes, obviously, paying money is worse for somebody who has less of it than the same amount of money for somebody who has a lot of it. And the same applies to the quantification that we can make with ordeals. Ordeals can be attractive to decision makers because there is something non-transparent about them. So if I'm trying to allocate more people to rely on the PAs than on the specialists, I'm running some HMO or whatnot. If I raise the copays, I need approvals. It's very easy to monitor. In certain cases, from a public insurer, there might be not even the executive arm, there might be the legislator involved. If I merely change the location of the office, it flies under the radar of a lot of this monitoring. That's easier for decision makers. It's also potentially less accountable and less democratic. So a complex point. I don't know what you want to make of this point. Financial participation hits our pockets. Ordeals, in some sense, hit us. Our body is being burdened by standing unpleasantly in the line, by getting up early in the morning. Our body is being tormented by this bad music on the phone when we call and try to speak to the administrators. Is that worse in some sense? Yeah, I'll skip this point. We might get to this during the question. Some comparisons, finally, to direct rationing. Ordeals are said to be more demoralizing for clinicians, and probably for good reason, than direct rationing, where they simply don't have the option of having to call the administrators, etc., to help the patient. They are sometimes burdensome on not just the individual patient and her clinician, but on the patient's families who need to drive them around, etc. That's clearly unfair. They sometimes harm patients who have incorrect beliefs about how much they need to see a specialist, say, or have an irrational desire to see a specialist, a prejudice, say, about the PAs, which is quite common. So these people, say, if they insist on seeing the specialist, will not benefit a lot because, ex hypothesis, we're assuming the specialist is not much better for them than the PA. But they will be willing to undergo terrible suffering to ensure that. The more abstract problem is that ordeals don't track our needs. They track our desires. And our desires can be fundamentally misguided or resting on false beliefs. I was thinking, so Jeremy Bentham is alleged to have said that soup kitchens should be humiliating so that the idle poor don't have to work, so that there is a disincentive for just relying on the soup kitchens for that in the industry houses that he was involved in kind of promoting. I looked a bit and I haven't found any place where he says directly that about dignity. But suppose he had, that's often cited as a problem with one kind of ordeal, which uses humiliation in order to dissuade you from consuming a good. Think about what is wrong with using that as a disincentive. After all, it gives people, you can choose between one of two options, and there are at least two things, at least one of two things wrong with this. One is, if you feel that people have a basic right to food, in some healthcare context, a basic right to some particular health services, not all, and you feel that people have a basic right to dignity, then you're making them choose between two right transgressions. That's arguably as bad as a right transgression, maybe counts as a right maybe is a right transgression. You can also argue that even if the good needed is not so compellingly needed, such as food, maybe it's merely seeing the specialist and things of that sort, using indignity as a disincentive tempts them to forego something which is a duty towards themselves, forego an inalienable right that they have, and that is in itself, this temptation, sometimes forcing when it's an undue burden, is bad. Some ordeals we mentioned are cruel or unhealthy, making somebody wait with a lot of pain for months, a tumor that is growing. They are very clearly inefficient and bad. Oh, sorry, I switched the order here, but you can see the points now. So I want to close this by leaving you with some questions. One is, what do you think about these candidate advantages and disadvantages? Are they for real? Are they not for real? Are there others that we missed? Are there some empirical questions that could help us figure out which is a real advantage, which is not a real advantage? And finally, what kinds of circumstances make it more appropriate to pick one kind of rationing over the others? So thanks a lot.
Thank you, Nir. Great. So our third and last panelist is Julie Rose. She is assistant professor at the Department of Government at Dartmouth. Before taking up her position at Dartmouth, Julie held postdoctoral positions at Brown University and at Stanford. She received her PhD from Princeton in 2012. Julie's work has appeared in the Journal of Political Philosophy as well as in Political Studies. Last year, she published her first book, which is called Free Time, on the value of free time and its distribution. One of Julie's very recent achievements is that she has been awarded a fellowship here at the Safar Center for next year. So those of us who will be here next year will get an opportunity to see more of her. Julie will discuss a more particular issue that arises in this area, namely the time dimension of some non-monetary costs.
I wrote an article 35 years ago in favor of physician assistants.
Physician assistants.
All right, thank you. And thanks very much for the invitation to be on the panel. So as Anders made clear, so my area of expertise is more in economic justice and distributive justice, specifically with reference to time. And so I'm going to be approaching the question about economic ordeals from that perspective, deferring to the relevant expertise on ordeals on the panel here. So let's see. So just to get us focused on the time dimension of economic ordeals, which is what I want to focus on specifically, I think we could start with an example that a lot of us have experience with, and which is also an example that's used in the developmental economics literature, which is on the costs to get eyeglasses. So even if we have generous vision insurance, the process of getting glasses can be really time-consuming. So first, there's the total amount of time that you have to spend in order to get the glasses. So you have to go to the doctor, they have to do all their tests, they have to dilate your eyes after they've dilated your eyes, and you can't do anything for a few hours. It's really annoying, and you're incapacitated in that way. Then you have to make another appointment to pick out a pair of frames, and then you have to make another appointment after the frames come in to have them adjusted so they fit your face and so forth. And then on top of all of that, you might not live very close to your eye doctor or to the eyeglass store, in which case you have to add on the traveling time in order to do those kinds of things. So I live in rural New Hampshire, where we have one eyeglass store. Luckily, there's not too far, but a lot of the people who live further away, it can be quite considerable. My grandfather, for instance, lived in the Adirondacks 2.5 hours from his ophthalmologist and had to travel, 5 hours round trip for each of those appointments. So the amount of time involved can really add up. And then on top of that, there are also these constraints it imposes on our time. So you have to find these 3 appointments at a time when the doctor is available or the store is open, so that constrains your time as well. And then if you're picky, you might also want a friend to come with you to pick out your frames, since they're going to be on your face. And So, you know, there's this additional constraint. Now you have to coordinate with both the doctor and the store and with your friend. So there's all of these time constraints in addition to the reduction on your time involved in getting glasses. So if we assume that glasses are necessary for those people who have impaired vision, then we could say that all of these additional time costs increase how much time it takes for us to meet our basic needs. And as a result, we have less free time, which we can devote to those ends beyond meeting our basic needs. So we have less time then to devote to any of our chosen pursuits. And I'll return to that idea. So the time costs associated with getting eyeglasses are not necessarily deliberately imposed, although I think that this process could be more efficient, and of course, Silicon Valley type companies are trying to make it more efficient. But the targeting mechanisms are specifically about deliberately imposed time costs. So these are time costs which are not essential to receiving the good, but then are added on in addition as a way of weeding out those people and soliciting information about who actually needs the good. So I want to focus on 3 specific types of time costs just to keep them prominent in our mind. So the first is the traveling time, so the commuting time in order to get to the store or the clinic. And so in the 2016 Dupas and co-authors paper that's been mentioned a few times, that was the example there. So in order to get to redeem the voucher to get the chlorine solution to treat the water, you had to travel to the store, to the clinic, in order to redeem the voucher every month. For some people, that wasn't very far, but for some people in the study, it was a longer distance. And so that might end up being a significant amount of time. Additionally, there's the waiting time. And by waiting time here, I specifically mean like when you're waiting on hold or waiting at the doctor's office, not the time lag between like I want the service and I can't get the service for 3 months. I mean active waiting time. And then there's also busy work time, so filling out those really long forms or dealing with the customer service representative at the health insurance company and so forth. And so Dupas in this paper at the end is suggesting some other uses for our deals, and she gives the example of in order to make sure that we're giving scholarships to the students who will really make the most use of them, we could potentially require students to fill out unnecessarily long application forms for every scholarship. So you can imagine that that amount of time might add up as well. All right. So what's important, I think, to remember about each of these time costs is that they're not essential to the provision of the good. They're deliberately imposed in addition. So they're making obtaining a basic good more time expensive than it otherwise would be. Okay. So imposing time costs might effectively reduce errors of inclusion, which is the goal here. So the idea is that we don't want to be giving the good to the people who don't actually need it or won't really make use of it. And that's an entirely fine goal in terms of target efficiency, as Richard would put it. And so I'm a perfectly good example of this. So I have a really, really mild prescription to get a pair of eyeglasses, but all of the associated costs with getting them have really prevented me from doing so. And so, you know, that seems like a good use of targeting. Like I'm the prime kind of person who's just going to overuse health resources. And so, you know, that's great that there was all this cost associated with getting the eyeglasses. And so similarly, in Dupas' study, it did really reduce the errors of inclusion. So people who had to redeem the voucher were more likely to actually use the chlorine solution than the people who just had it provided for free at their home without any associated time cost. But time costs might also increase our errors of exclusion, which is another way to think about this. So that is the cost is so high that it deters people from obtaining the good which they really need and really would use. And so economists will often talk about how the opportunity cost of time for the wealthy is higher. So it costs people, rich people, more to spend time because they could be earning more money in that time than a poor person, so it's easier or cheaper for a poor person to spend the time. And while that is true, of course, it doesn't get around the fact that some poor people just have very little free time. And so the fact that their time is less valuable is kind of beside the point. So if you just don't have enough time to spend, then the errors of exclusion could be quite serious. So of course, people who earn low wages might have to work very long hours in paid work, so they might have little time on that account. And then on top of that, low-wage earners generally work more inflexible work hours, so they are less able to rearrange their schedule so they can get to the doctor's office at the time that it's open. And additionally, low-wage workers generally have much less paid time off. In the US, we aren't legally mandated to provide paid time off, so they might have no sick days, no vacation days, no other paid time off. So again, that means that you just might not have the time to spend to meet these ordeals. And then on top of that, we also have to remember that the poor have less money available to spend on time-saving conveniences like the rest of us. So they, for instance, a good example is like having in-home laundry. Like if you have to go to a laundromat and sit there for hours while your laundry is done, like that's a significant amount of time that people with a bit more money can really save just by like, you know, sticking the laundry in while you're doing something else. So all of those types of things, like they also can't hire services, you also can't buy prepared foods, like a lot of different things that we take for granted as time-saving conveniences. All right, so the development economics literature is very sensitive to both errors of inclusion and errors of exclusion. So the Dupas paper, for instance, argues that because the chlorine voucher reduced the errors of inclusion without increasing the errors of exclusion, then it was an optimal policy. And so she's quite sensitive to the errors of exclusion problem. And if the ordeal was to deter people who needed the good from actually getting it, they would really take that as a count against the ordeal. And I think that that's quite right. But my point I want to make here is that I think that even if people can pay the cost and do endure the ordeal in order to get the good, it's still imposing other costs on them, and that we should be sensitive to these other costs as well, and that these other costs might be so significant as that they might amount to unfair burdens, even if people are not being excluded from obtaining the good. And so just to be clear, too, I mean, I take Richard's point very well that I'm not making an all things considered argument against ordeals, but just raising some concerns about their design and arguing that we ought to be especially careful about these costs when we're designing ordeals. So first, just as a preamble, so how onerous the ordeals are is, of course, going to depend on just how much time they require. So if it requires just 5 minutes to walk across the street to a store that's right there to redeem your voucher, then that's not a very onerous cost. But if it requires, you know, driving 5 hours round trip to get to the eye doctor, that's a much more onerous amount of time, and if the hours are constrained and so forth. And the thing that I'm actually more concerned about is if we were to endorse time-based ordeals, they might be then added on to the receipt of lots of different basic goods and services. So every time you want to get a doctor's appointment, or if you are a low-income person who has a rent subsidy or food stamps or all of the other types of social services that are important basic goods, if all of them have an additional time tax, then in aggregate that could really add up. So we have to evaluate not just whether or not the time associated with one ordeal, but the time associated with facing all of these different ordeals. All right, so basically, if we add time costs to the receipt of basic goods, we're making the satisfaction or the meeting of one's basic needs more time costly. It's taking more time to meet the necessities of life. And as a result, we have less time to spend on those things which are not the necessities of life, which are our chosen pursuits, the things that we want to do. So the first cost is that just by making it more expensive, time expensive to meet our basic needs, this might impair our ability to meet our other needs and obligations. And this is a relatively minor point, but just worth knowing that if we've added all these time costs onto getting the basic needs, it might then be more difficult to fulfill the terms of one's employment or to satisfy one's caregiving obligations, and those are real concerns. I say it's minor only because this seems like it would be contrary to the designs of the person who's trying to implement the ordeal, so you would try to control for that. But it's an important thing that you'd have to try to correct for. But then on top of that, and more essentially, this just reduces how much free time people have. And I think that that's an important loss. So the first point is just that free time is valuable, and we should just accept that. And so time is a necessary input in order to do any of the things that we might want to do. And so if we're reducing how much free time people have, we're depriving or reducing how much of a valuable resource that they have. And so that's a real loss. Right? So that's just one point. We have to be aware of that cost when we are evaluating these ordeals. On top of that, I would argue further, and this is what I've argued in the book that Anders mentioned, that I think people have a claim to a fair share of free time. So it's not just that free time is valuable. I think that we have some kind of entitlement to free time. And so here the worry would be that if ordeals would depress our free time below the amount to which we are entitled to have a fair share, then it's not just a cost, it's potentially unfair and impermissible to be imposing ordeals in this way. So just very briefly, the argument there in a nutshell is that as members of a liberal society, we're entitled, we have this set of formal freedoms that we are entitled to. So freedom of religion, freedom of association, freedom to participate in politics, freedom to do all sorts of different things. But if we don't possess the means to actually make use of those freedoms, then we possess those freedoms in name only. And this point is generally recognized with respect to material resources, but I think it also holds with respect to time. So to take a simple example, in order to exercise one's right to vote, you have to have the money, the means to get to the polls. So you need money for a bus ticket or gas money or something like that. But you also obviously need time to get to the polls. And I think that that argument holds more generally across all of the things that we're legally free to do. And so for that reason, if we think that people are entitled not just to the freedoms, but to the means to make use of them, then we would have a claim to free time. So if we then accept that argument in a nutshell, then ordeals are concerning insofar as they are potentially reducing how much free time people have, and perhaps people who already have less than their fair share of free time, we're now further depressing how much time they have, all right? And the last point related to that is that they might limit our ability to participate in social and political life. So social and political life generally requires having time available at particular times. So that's the political case, but also it just requires having time available at the same time that other people have time available. And just as you reduce the amount of free time that each person has, so the low-income person who has to spend a lot of time on these ordeals, potentially, this is a kind of worrying case to me, then they just might have less time to be participating in all of these different social activities, which I think are tremendously important and which I think we also have a right to as part of our freedom of association. Okay. So importantly then, I think that this isn't to say that we can't ever use time costs as a type of ordeal. So if the person has a lot of free time and if the time cost is slight, then there's very little reason not to use the ordeal, and it might be efficient and we might want to do that. But if the person has very little free time, one, if you accept just the claim that free time is valuable, then that's a cost that has to be weighed. That's the first point. And then if you accept my stronger claim that not just is free time valuable, but we also have a claim to some amount of free time, and if we're talking about people who already have very little free time, so much so that they might already be below their fair share, then further reducing their free time seems to me to be impermissible and a very strong reason not to be using time cost ordeals. All right. And then on top of that, okay, so I do think then that that might just give us reason not sometimes to use ordeals at all, but I take the point that sometimes we do need to use ordeals, even though my inclination is always in favor of free provision, just give it all out. But taking the point that sometimes we do need to ration. I think that there might be some reasons to use money instead of time. And importantly, by money, I do not mean just a straight market solution or a flat fee. That seems to me obviously impermissible. Instead, I mean some kind of highly progressive or refundable monetary cost that is designed with the same type of care as an ordeal is, and not just the market solution. And so I think that there are three reasons why we might prefer money to time. So the first is that it's much easier to obtain information about how much disposable income people have than how much disposable time they have. So the IRS already collects information about how much time how much money we have. A lot of social service programs are already means tested with respect to money. But as things stand now, we don't actually have a very good picture of how much time people have available. One, we don't really collect the right kind of information about what their work hours are. And not just in the aggregate, but do you really have to do mandatory overtime? How many vacation days do you have? How flexible is your schedule? How difficult is your boss? Those types of questions. We also don't have this much detailed information about how onerous are your caregiving obligations, or how onerous are your own physical bodily needs that you have to spend time meeting. So we don't have that kind of information. I think we probably should obtain that kind of information in order to provide people with their fair share of free time. But as things stand now, we don't. And so I think that's a good reason to be cautious about imposing time-based ordeals on people who might have little free time, even though we don't know that they have little free time. And then additionally, I think it's easier to make monetary costs progressive. So partly because we don't have this information about how much time people have, but also just it's hard to imagine exactly how this like highly progressive time cost would work. So take traveling time, for example. Like how much time it takes to travel to the clinic depends on how far you live from the clinic. But now we would want to be trying to do this in a progressive way so that the people who have very little free time only have to travel a short distance, and the people who have a lot of free time would have to travel a longer distance. But given that the people are not organized with respect to the clinic in the way that that would require, then it's difficult to know. You'd have to be very clever in order to implement this in the right kind of way. And similarly, like imagine that you call the doctor's office or the health insurance company and your waiting time is now like, if you are a time-pressed person, you have to wait 2 minutes on hold. And if you're a person with a lot of free time, then you get to wait an hour on hold. But again, this is compounded by the problem we don't really know who has the free time, and then we'd have to implement it at the period in which you're calling up, and it's trying to be designed in that way. Similarly with busy work, like you get a very short form or a very long form, but somehow the bureaucratic agency has to know like just how onerous are your caregiving obligations and how onerous are your bodily needs, and is your boss really difficult and you have very little free time? Here, take the short form. And then if you answer no to all those questions, here you get the really long form. It's just difficult to imagine how exactly we would be implementing that. And then on top of that, we can also make monetary costs refundable. And a refundable monetary cost might be a pretty good ordeal. So you have to be willing to like pay the money and be without it for a little while, even though you're going to be getting it back. And importantly, we wouldn't want to make the refundable monetary cost so great that you just couldn't pay it, which is like a kind of Republican idea about tax credits and so forth. But so if it was a low monetary cost, that might be a good solution. So you have to be without the money for a little while. But it's hard to see exactly how we would make a time cost refundable. So I've now spent 5 hours to get to the doctor's office, and you're going to refund me my time. It's like, how, like the time is already gone. Like, how are you going to do that? So obviously you could give me money, but it might be imperfectly substitutable with time. So say, like most of us can't actually tell our employer, like, here, I'm going to give you this much money. Will I then be relieved from work for 5 hours? And that's not how the terms of employment usually work. So money and time are not substitutable in this way. So these are all reasons why I think like a highly progressive or a refundable monetary cost might be preferable to a time cost. I do think that we could have a time dimension as ordeals. So I flagged at the beginning like the difference between active waiting and passive waiting, if we want to put it that way. And so passive waiting might be a fine type of ordeal because you aren't losing free time if, say, you have to wait 3 months to see the specialist. And I think actually this is a big part of why I haven't taken the time to get the eyeglasses. It's not just like all this time that I'd have to spend, because I guess I do actually have it available, but like the absence of instant gratification is enough for me to be like, I don't really need the glasses, because I couldn't walk into the store and walk out with them 20 minutes later. I'd have to wait a few weeks for them to come in the mail or something. So I think that that could be an effective ordeal, and it's using time, but not in a way that actually deprives people of free time. All right, so just to kind of sum up here, I think 2 main points I'd want to make. So one is that free time is valuable. That's the weaker claim. And then the stronger claim is that people have a claim to a fair share of free time. And so if you accept those things, then I think that when we're designing targeting mechanisms, first we have to evaluate how much free time recipients have and be sensitive to that to the extent that we can. And then if people have abundant free time and the time costs are moderate, then the ordeal might be just fine, the people who have a lot of free time. But if people have very little free time, then I think that we have strong reason not to be imposing additional time costs as part of our ordeals, either because free time is valuable, so it would be costly, or because this would be unfair. We'd be reducing their shares even below. And then, you know, these points about why we might prefer the monetary mechanism over the time-based mechanism. So trying to be constructive rather than just critical, I would urge us to go in that direction rather than in the time-based direction. All right, thanks very much.
Thank you very much, Julie. So now we'll open for discussion. Yes. So let's start over here.
I have a question for Richard and Jake. I want to ask you about some mechanisms that might make ordeals not just second best, but third best, and the solution to the third best might make it fourth best. And to get to this, I want to tell a story that actually goes back more than 30 years ago, at the time that Nick was teaching me microeconomics and you were teaching me everything else, Richard. Harvard had just opened a new pool, Blodgett pool, and they decided in their wisdom to allocate lockers in the pool through an ordeal. They had permanent lockers, which you can get, and then transient lockers, and they had to decide how many of the lockers would be transient and how many would be permanent, and they decided to allocate this by having you wait online for hours and hours and hours. Standard ordeal. The problem is that there were some people, and I remember this very intensely because I was one of these people, waited online hours and hours and hours, and we didn't get a locker, right? So this is like a dead weight loss on top of a dead weight loss. So it's not just that the people who got the lockers had this additional ordeal, but there are lots of people who went through the ordeal and actually didn't get. Obviously, you anticipate this, and it's just one of the costs of target efficiency. But here's the fourth order problem. So now, no one likes to have this kind of situation where you impose an ordeal, and some of the people who went through the ordeal actually don't get the good. That's terrible. So now you have two choices. One is you can realize, oh my, we misallocated the resource. Maybe we should have more permanent lockers in Blodgett pool. That way we could have not a market clearing, we could have supply and demand clear. Of course, there's another possibility, which is we could just up the ordeal. We could make the people online stand on one foot, and then we would have a market clearing situation. So the question is, because usually there isn't a fixed scarcity. Sometimes today, there are only so many kidneys, you have to allocate them in some way. But usually for the kinds of goods that we're talking about, like healthcare, it's up to us or some other allocator to decide how much of the shortage there's going to be. And how do we decide that? We decide that through information and a feedback loop. If the worst possible outcome is for lots of people to go through the ordeal and not get the good, it's extremely tempting to crank up the ordeal so that the market clears. And so the problem, which I'm sure Nick and Richard you've already thought about, is there's a way in which these ordeal mechanisms could be information impoverished because there's a temptation to actually increase the ordeal when what you really should be doing is relaxing the constraint on the scarce good itself.
Okay, so I'd like to, Arthur's always a challenging person. I was going to make the point, if I had taken my full 25 minutes, we were allocated 15, which I took. My son recently moved to Rhode Island. He called up about healthcare exchanges. He waited an hour on the phone, and then they closed for the day. We should have more resources. I want, where we do use ordeals, and you understand, I just sort of said they should be used here but not here. We should be smarter. One of the things you studied was queuing theory. I suspect, let's say Rhode Island has 7 people waiting on the phones. If everybody ultimately has to speak to them, with a queue, if you slightly increase the service capacity, you can dramatically reduce the waiting time. So if they added an 8th person, that might have gone from an hour to 15 minutes. That would be desirable. There are many useless ordeals. Useless ordeal is what you have at doctor's offices. They could easily schedule you. They're going to see the same number of patients. They could tell the person who's scheduled for 2 to come in at 3:15 and be realistic about what they ordinarily do. You mentioned kidneys. If you had been in the SAFRA program 25 years ago, you would have talked about the allocation of kidneys. Our society has worked out a terrible ordeal for kidneys, passive waiting. What do? Everybody comes in when they need, basically when they need a kidney, and then a new kidney becomes available, and we give it to the person who matches, who's been waiting the longest. That person's health has already suffered. They will get less use out of it than somebody who came on the waiting line a year ago. Why did they do it? Many people, I suspect some people in this room, argued that that way everybody still has hope. Much better to give 90% of the kidneys on a cost-effectiveness basis, who will get the best use, and 10% on the hope criterion, which is you've been waiting long, you may have a chance to get it. Poorly designed ordeals, let me just give one example from Nir's thing. I'm a great enthusiast of physician assistants. The way to get people to use physician assistants, I believe, is one, it's an experience good. If you've ever gone to a physician assistant, it works well. They spend more time with you, they understand your condition better. It's really very good. And a good specialist will sort of say, go see Richard, the physician assistant. And Richard is also trained to say, oh, this is something where you need to see the specialist. Fortunately, Nir is 2 offices down the hall, and he will come in and he will see you. The example that I like to use, because I use emergency rooms, an innovation during your and my professional lifetime has been the community healthcare center. And 35 years ago, if you had a problem, you went to the emergency room. And now many of those problems, like a lacerated finger, you go to the community health center or even to what's now called minute clinics. Minute clinics are great because it's something that Julie would like. It really takes you a minute to see, or maybe it takes you 5 minutes. But they're no different from Amazon. They're trying to make your experience easy so that you come to them quickly. So my basic point is many, many ordeals could be designed better. I just want to say one last thing. I didn't take my photo, which is the way some of your colleagues, your former teachers, manage to prevent any old student from coming in is they say, oh, yes, I'd like to see Professor Applebaum. And he would sort of say, you can see me in 3.5 weeks. My mechanism, I'm giving this away, everybody should use it. My mechanism is to say, write me a 2-page memo about what you want to discuss. Okay? It's incredibly valuable. They think before you come in. I can read it before they come in. And by the way, 15% of the people who wanted to see you, who were there so that they could sort of say, oh, I got to see famous Professor Applebaum, or so they could ask you for a recommendation later, don't bother to come in. So it's a well-designed ordeal.
You still didn't quite answer my question, which is when the amount of the scarce good to be allocated is uncertain, how do ordeals tell you how to adjust that?
Well, you should learn early. You should have learned in the, it's a little bit like when Americans lay out paths in New England, we wait till it snows and we see where people walk. What you should do is you should build some lockers and then see what happens. And if it's a long wait time, you say, oh, we should build more lockers and have a smaller weight room or whatever else it might be. Or smaller lockers, so you can't put in quite as many clothes, but you can do it. So don't fill in all of the locker rooms. So you should learn. And learning from your past mistakes, like we haven't learned in 50 years how to allocate kidneys, is an important lesson about ordeals and about almost everything else. My past good decision was helping you get your PhD.
Yes.
Midlane, Princeton University. I was wondering if it makes a difference when it comes to the ethics of economic ordeals, what the aim of those ordeals is. So, for example, there might be cases where you're trying to allocate a genuinely scarce good. For example, access to a surgeon who specializes in a very rare kind of surgery. But there are other types of aims for economic ordeals where you're, an insurance company might be trying to make a lot more money by making access to medicine more difficult, and thus they're increasing their profit or bottom line. So I think, does it make an ethical difference, the aim of the economic ordeal? And second, to build on Julie's excellent point when it comes to the fairness of these economic ordeals, you made the point that the poor are potentially more subject to economic ordeals than other people. And considering that the black poverty rate is 3 times higher than that of the Caucasian poverty rate, do you think that the use of these economic ordeals might potentially exacerbate racial inequality?
Well, about the first point, I would say I'll leave the second point to Julie. The way we think about it in our paper is there are ordeals that can arise the way we define ordeals without anybody intending for them to arise. So it just happens to be the case because of some circumstances that something, say, is more onerous than something else, and it in fact creates a disincentive to do that. Sometimes somebody intends it one way or the other. Sometimes they fail, sometimes they succeed. So the aims we tend to think of as not affecting the rightness or the wrongness of the act, more the blameworthiness of the person. But that's just one way of thinking about aims in ethics in general. But in any case, you're totally right that some ordeals are systematically, sometimes because of intentions, systematically serving bad causes. And clearly, those are problematic.
Great. Yeah, no, it's an excellent point. So I think it's unfair for any person who has little free time to then have their free time further reduced through an ordeal. But then the unfairness would be exacerbated if this is just compounding other types of inequalities that already exist in our society. So different, like the black and white poverty rate is a good example. The other very good examples have to do with gender. So if women, working women, women with young children, women with caring for older people have less free time, then they're going to be disproportionately burdened by the ordeal, or people who have time-consuming disabilities. There are a lot of different types of groups, and obviously then these all intersect as well. And so each of those, I think, would compound the unfairness. Although I would want to hold on to the idea that it's unfair for any person who is then reduced below their fair share. Thanks.
I thought it was really interesting. I hadn't thought about this before. I have an observation and a question for all three of you, I guess. So the observation is this. So there are types of ordeals which do not seem, to me at least, to be a response to the problem of scarcity, but they are a way of not distributing, of managing to not distribute a resource that is not scarce, but which we don't particularly want people, to get. And the example that I have in mind, which has become very salient in the political context of post-Brexit Britain, is the increased degree of difficulty, which is a time-related difficulty that people have to overcome if they want to apply for permanent residency. Or indeed citizenship, in Britain. So, strictly speaking, citizenship is not a scarce good. The British government could very easily give British citizenship to every single long-term resident in the country who wants it. But in the last year or so, they've made it incredibly difficult. I mean, the form is now 80-page long. When I did it 5 years ago, it was 30-page long. It's now 85, page long. The list of documents that you have to supply is getting not only increasingly long as well, but these are documents which are becoming quite hard, to track down, the longer you have lived, in the country. And it seems to me that, this raises interesting questions of justice. And actually, one of the interesting features, perhaps, of the example for your purposes, Julie, is that here we have a case where time-related ordeals are designed in such a way to intentionally make it difficult for people to exercise one of their rights, the rights to take part in the political life of the community by becoming a citizen, of that community. So my observation is that, thinking about economic ordeals, which I understand are a response to the problem of scarcity, might help us think about, other kinds of, ordeals, which are not a response, to the problem of scarcity as we understand that problem ordinarily, in the context of, distributive justice. So that's just an observation. But the question is not a critical question, it's a clarificatory question, which stems from my difficulty in understanding exactly what you mean, all three of you, by economic ordeals. And it seems to me that some of the examples that were given are not, or I don't think of them as economic ordeals, but as needs combined, with a particular form of prioritarianism. So, the example that puzzled me particularly is the example of the waiting time, at the hospital. I think it was, your example, Richard, where, I turn up, I have a really bad cut, which needs, sorted out. I'm going to wait, 3 hours. Someone comes in with chest pain, is whisked away immediately, to the operating theatre. And it's not clear to me why I should think of that, as, unless I've misunderstood, you know, as an example of an economic ordeal, as opposed to the view that we allocate healthcare on the basis of needs, where the neediest person, in that instance, you know, the person, you know, who is about to have a heart attack, you know, has to be given priority over the less, you know, needy, you know, person. So what's the, you know, what do we gain, as it were, philosophically speaking, by saying, well, you know, we have a slightly different distributive rule, you know, different from, in that instance, allocating on the basis of needs?
Well, the reason that the emergency rooms do this, emergency room facilities are expensive, and there are many times, I mean, I cut myself, and I tend to sort of say, oh, well, I don't want to go to the emergency room and spend 3 hours, whatever else it is. If you used to go to Children's Hospital, when my children went to Children's Hospital, you saw people who went there because their child had a cold. And if you have to spend 3 hours waiting to see the physician when your child has a cold, you'd be less likely to do that. So that's the reason. I just want to make the second point. My guess is you shouldn't use your objection to ordeals because your political views on an allocation of a resource are different from other people. My guess is, looking at the Brexit vote, is your view was Britain could take in many, many more people, maybe an infinite number of, as many people who want to come, and let them become citizens. But the British populace voted to sort of say, we really want to restrict, as did the American populace, we really want to restrict the number of people who come in here. So we're catering to, you know, the median Brit, not the most liberal Brit, as to whatever else it is. I'm all in favor on HB1 visas. This is Richard Zeckhauser's personal view. I would like to let in, you know, tens of thousands of people with, you know, high skills. But I'm sort of in a minority, so I don't get to sort of say the fact that it's, you know, this year when we gave them out, I think they were all gone, the applications in 3 days.
Right. Well, I don't
Things like that. And, you know, it's just, my views are different from the average Americans.
You guys want to?
People
Okay,
ask
okay.
another
So you've been waiting.
Thanks for those 3 great talks. I first had a question for Julie, and then I had a question for all of you. So the question for Julie is, I agree that there are many advantages of, for financial ordeals over non-financial ordeals. Though, of course, it's not always so, and I think it wasn't always so in some of the examples you gave. So one example you gave is that it's hard to find information about people's time needs. But with travel time, it's very easy to find that information in virtue of the fact you know where they live and you know where the clinic is. And not only is it easy to find that information, in many cases it's easy to reduce the amount of time expended for certain kinds of things. For example, use the example of glasses. I had these glasses shipped to me online, right? And I could provide an online prescription, so I didn't have to go in. They give you, you know, instructions about how to adjust it yourself, and then you've got very low time requirements for doing so. It's kind of a minor point, but you could also see it in other cases where you have telehealth conferences for people's dermatology needs or other health contexts. So that's just a minor point. And the more substantive point I had was all the talks focused on kind of individual types of ordeals, so financial ordeals or time-based ordeals. But I think there's a lot of interest, a lot of importance to think about hybrid ordeals. So the one that people might be understand pretty easily is Shakespeare in the Park. It's something that goes in New York City every year. Famous actors put on a Shakespeare play in Central Park. You can line up for a very large number of hours. That's one way you can do it. Another way you can get a ticket is by going through an online lottery, right? You have a much lower chance, but you still have a chance of getting it. Or you can donate a lot of money to the organization, right? So it's kind of 3 possible pathways, and given it's a hybrid approach, it has not all of the difficulties of any one of those approaches. Now, there might be special problems for hybrid views, but I would, you know, kind of interested in what do you think about kind of these hybrid ordeal models?
Sure.
There can also be hybrids inside one of these categories. So, for example, I think one way to address a lot of the concerns about some particular people, and it's hard to tell in advance whom don't have enough time, is to say, well, you know, you choose whether it's going to be listening to bad music on the phone, or spending a lot of time driving, or et cetera, et cetera, et cetera. And then through that, so you pick your torture, and then it doesn't kind of systematically affect certain groups of people. You could, so in the New York example, it releases us from the worries that Julie raised to a great degree. It's unfair that people who have money to donate can get, I think that's how acceptance to kindergartens in New York City also works, right? Either your child is brilliant, or you're very charming in the interview, or you donate a lot of money in daycare and you document that, because, it's unfair. It's not as unfair as the only way to get into kindergarten or to the concert is to donate, but it's a little unfair. So.
Maybe. So if a donation in support of the very venture that is involved, maybe it makes more seats available.
Okay. Yes.
Thank you. This was fascinating. Ordeal is a form of rationing. I'd never thought of it before. You're talking, most of you talked about the uses and disadvantages of it for particular policies, for particular distributions. And Julie, I thought, started to move us in the direction of the accumulation of these ordeals in individuals' lives, right? You didn't go as far as I would go with it, and the cost that you talked about was the cost of free time. And I just have a comment to make, which is that people, and especially poor people, for whom what you're describing as ordeals is a regular part of getting most of their lives, most of what they need in their lives, the consequence is not just less leisure. The consequence is frustration, it's anxiety, it's depression, it turns to resignation and passivity, and we know something about this. Now, I don't know if this is quantifiable, I guess it is, and I don't know whether it affects policy, but it is a consideration in talking about the disadvantage of ordeal.
Yeah, no, I think that that's entirely right. I've been focusing on the time part, but I think that these other costs are very much present, and then they're compounded by the disparity that often lower income people tend to have less bandwidth available to spare to begin with, and then you add all these ordeals on top of it. It starts to become perverse as a way. It's like we're ostensibly giving recipients these basic goods that they have claims to, but we're imposing such constraints on it that, yeah, it's troubling. And just a quick response, and I think that sometimes the hybrid solution might be a good one, like the kind of pick your poison method. If you have a lot of time, you can wait. If you don't have a lot of time, you can spend money. I would just want to flag as another potential concern the possible status differential. So if the wealthy people don't have to wait in line and they can kind of just like waltz into the Shakespeare in the Park, and the other people have been camping out for days, like this, and again, if this becomes not just with Shakespeare in the Park, but as part of a broader social system, then there's a real problem for the possibility of status differential where people with little time and little money, the status differential is just highly exacerbated as a result even of these hybrid ordeals.
Nancy, on a very important point, because these small ordeals, the development economists actually call some of the really, really little burdens micro ordeals, are actually very tempting to use a lot because we've identified some problems earlier in the ordeals that involve an undue burden or severe pain or those kind of gruesome ordeals. So you want to often go for the small ones on the assumption that they will function as nudges, basically because people are hyperbolic discounters, et cetera, walking to the next side, the other side of the same hospital is something that people irrationally will prefer to taking good care of their own health, which in their minds involves being a specialist. So a lot of times we rely on these nudges, but in accumulation, not just for the individual patient, also for doctors, for example, if we make them have to scroll down to the bottom of some list to pick brand name, not generic, on their computer screens, in accumulation, there is actually now documentation. It costs them a lot of time. It's not trivial. So an interesting kind of aspect of kind of planning social policy is that these kind of small burdens that Francis yesterday said we shouldn't ever aggregate, in fact, do aggregate, and at some point, their accumulation is a significant burden that maybe even Francis would have respect for. So the social policy should, I think, be done from the point of view of somebody who is planning in advance and thinking there will be a lot of burdens, not from the point of view of somebody who thinks, as Francis wanted us to do, about a single decision.
I just want to say one, I like hybrid ordeals. Two, in order to get your thinking straight about ordeals, I urge you to think of how you would feel in a different society. Say Sweden, much more egalitarian, much more racially homogeneous. Would you be more enthusiastic about using ordeals to allocate resources in Sweden than in the United States, or less enthusiastic? If you can't get your thinking straight for an egalitarian society, you're going to have a harder time getting your thinking straight for our society.
I think one last question, right?
How are you going to allocate it?
So I'm going to go with lottery.
If you have a really good question, raise your hand.
Okay, she in the back, she's so enthusiastic, so...
You have a good question. I once wrote you a 2-page memo as well. I'm actually really surprised we've had this whole discussion without work requirements coming up, because that seems to me to be a very sort of popular, perhaps increasing sort of ideal for various public service programs, perhaps someday soon in Wisconsin, even Medicaid. And it also seems potentially like a really morally problematic ordeal to me, but it doesn't seem potentially morally problematic from the direction that we've been talking in terms of how ordeals affect who selects into receiving services and who possibly is excluded. It seems potentially morally problematic to me because it, in and of itself, sort of reflects a particular mental model of how people are living their lives, either according correctly or not. So the idea of work requirements seems to me to rest on a mental model of people who need services, cash assistance, welfare, other sorts of social services, are actively not doing what they ought to be doing, which is engaging in formal paid labor in the formal labor market. I don't want to say work because they do lots of work, but they're not engaging in this particular sort of market. So I'm wondering if you could comment on sort of the ethics coming from the other direction in terms of how people who are selecting what the ordeals are might be integrating particular moral stances into the ordeals and how we ought to think about that.
You've written the most in Bankberg, Richard?
Obviously, anybody who creates an ordeal has their moral views. It's a little same as what I was talking about to the woman who asked about, English visas or English things. So if I think that my personal view is you could have a more sophisticated thing than work requirements, and you could have people who you could sort of say, obviously, these people can work, these people can't work. My school was a hotbed of discussion of work requirements because 2 people at my school helped design the Clinton Welfare Initiative, one of whom subsequently resigned because she didn't like it. And my view, I'm an economist, I was worried about elasticities. If I thought that would get 90% more people into productive work, I'd be in favor of it. Understanding that it's unfairly penalizing the 10%. If I thought it would get 10% more of the people into productive work, I would be against it. Only an economist likes elasticities.
You want to comment on this? Okay, so thank you to our speakers. Our time is up, unfortunately.